Poland is the ninth largest country in Europe for size and population, which is 38.4 million. By the 1980s, Poland had reached the highest rate of smoking in the world. After World War II, cigarette consumption and sales soared, reaching their peak in the 70s and 80s with annual consumption at 3,600 cigarettes per adult. Public health organizations and officials faced very difficult challenges from the effects of this epidemic due to cardiovascular disease, cancer, sudden death, and unhealthy lifestyles connected to smoking and drinking. By 1982, daily smoking reached an all-time high, with 65% of Polish men and 32% of Polish women who admitted to being daily smokers. With these outrageous percentages, smoking easily became the largest single preventable cause of death in Polish adult population. The 80s were also considered a time where smoking attributable mortality was the absolute highest, causing 1 in every 10 deaths. That's not all. Current smoking patterns indicate that smoking will kill about 1 billion people this century. Not only in Poland, but in countries everywhere, smoking was at an all-time high. Appealing advertisements flaunted the now ridiculous theories that smoking could curb appetites to make you skinnier, smoking was cool, and smoking couldn't hurt you. In advertisements, doctors smoked, dentists smoked, babies, models, and even Santa smoked. Filtered cigarettes arrived with doctors as the main advertisers, claiming their brand to be healthier for you because they filtered out all the smoke. Advertisements targeted women by making packaging more appealing and claiming that they would make you thinner. They made tobacco smokeless, claiming that not breathing in the smoke was better, and created menthol and other fancy attributes to make them more and more appealing to all sorts of people. Once the media grabbed the attention of the public, business was booming for the cigarette companies and the government, and there was no stopping it. Countries around the world, including Poland, began slowly noticing the connection between all these health problems and tobacco. Smoking tobacco's leading cause is premature death, but that's not all. Smoking causes cancer of the bladder, kidney, mouth, pancreas, and stomach. Lung cancer is the most common disease caused by smoking and is responsible for 1/2 of all cancer deaths. Smoking causes major cardiovascular diseases like stroke, heart attack, and as well as respiratory diseases like emphysema. Research also began finding that not only was actually putting the cigarette in your mouth terrible for you, but smoking around others could have serious consequences. Secondhand smoke affects mostly children whose parents smoke and contributes to ear infections, asthma attacks, sinus infections, and throat inflammations. Smoking around pregnant women can contribute to sudden death syndrome, low birth weight, and other problems. Although tobacco takes a toll on everyone economically, poorer countries are the most affected. Poor people are more likely to smoke than rich people, and currently 3/4 of the world's 1.2 billion smokers live in low and middle income countries. The economic and health issues that are paired with smoking affect the poor more than it would affect the rich. In Poland alone, for men, the gap in the risk of dying early between educated and uneducated men is due to smoking. By 1990, the probability that a 15-year-old Polish boy would reach his 60th birthday was lower than most countries in the world. Not only is this detrimental to families, but countries are losing workers, and it puts a burden on health officials and organizations. Poland took the incentive to stop smoking and set an example for countries to follow. This is harder than it looks because not only do you often need to help these people medically, but everyone who smokes needs to change a behavioral issue. Getting people to quit and keeping people from lighting up was an absolute top priority. This was difficult for countries everywhere trying to get people to quit. Tobacco is addictive, and at that time it was socially popular. Not only Poland, but many countries at first did not realize that the reason all these health problems were coming up was because of smoking. Poland was going to find a way to stop it, but they knew that it was going to take a high-level political cooperation as well as cooperation from their people. Times were stressful in Poland because of the social and political climate at the time, and the government, who was making money from the cigarettes, did not tell anyone the negative effects of smoking. Since the economy was not doing so well, the Polish government was not willing to take the risk of allowing tobacco control laws. After the fall of communism in Poland, all of the social, political, and economic changes amplified smoking, and tobacco was the first industry to become privatized. Cigarettes were cheap and appealing. Once democratic changes took over, fancy marketing took over, and about $100 million was spent on tobacco marketing. This particular population and region desperately needed to quit. Research by Polish scientists in the 1980s began the movement to end smoking by providing facts on the health impact of tobacco. Conferences in Poland were held to support the tobacco control legislation and inform the public on the harmful effects of smoking and highlight that smoking was the main contributor to the cancer outbreak in Poland. The Polish Anti-Tobacco Society formed and began interacting with the WHO, the International Union Against Cancer, and other groups. The new political policies allowed non-governmental organizations to form, which only amplified these anti-tobacco groups. Poland hosted a Tobacco-Free New Europe conference where the new recommendations for changes in policies were made that would help create anti-tobacco laws. The Health Promotion Foundation led the way for educating the public on the effects of tobacco. Polish press began covering scientific studies done that highlighted the consequences of smoking, and word began to spread as these organizations raised awareness and educated the public and even gave some simple tips on how to quit. This media movement and the organization began to make efforts towards changing tobacco control legislation. In 1991, recommendations of tobacco control measures were brought to the Polish Senate. With much opposition from the tobacco companies and even the government, who were both profiting incredibly from tobacco sales, they argued that it would be suicide to Poland's economy. It took a few years to finally break some ground in the movement. In November of 1995, Polish Parliament passed Law for the Protection of Public Health Against Effects of Tobacco Use. This legislation included a ban on smoking and the sale of cigarettes in health centers, schools, and enclosed workspaces, a ban on the sale of tobacco products to minors under the age of 18 years old, a ban on the production and marketing of smokeless tobacco, a ban on electronic media advertising and restrictions on other media, the printing of health warnings on all cigarette packs to occupy at least 30% of the packaging, free treatment for smoking dependents. Once other countries saw the great strides Poland was making, they decided to follow suit. By 1999, the tax on cigarettes increased by 30% each year, and a total ban on advertising was also passed. In Poland, it is required to give 5% of all tobacco taxes to funding prevention programs. The Health Promotion Foundation made a great impact on the people by educating them and offering help for their addiction. The HPF held an annual campaign called the Great Polish Smokeout, encouraging people to quit. This Great Polish Smokeout even included a competition that worked as an incentive to quit for the people. Polish smokers who have quit smoking in the past year were required to send in a postcard for a chance to win a week-long stay in Rome and be in a private audience to Polish-born Pope John Paul II. The Great Polish Smokeout attracted media attention, which spread to homes everywhere with how and why to quit. By 1991, 2.5 million Poles had quit because of the campaign. Increasing cigarette price kept Poles from purchasing cigarettes and stopped those from starting. Also, tobacco taxes were a large source of funding for the tobacco control and health promotion activities. These funds are also available to be used for the treatment of HIV/AIDS, tuberculosis, and malaria. Between 1990 and 1998, cigarette consumption dropped 10%. In the 70s and 80s, over 14 million Poles smoked. By the end of the 1990s, less than 10 million Poles smoked. Not only was Poland putting out their cigarettes, the overall health of Poland improved. The total mortality rate in Poland fell by 10% in the 1990s. Deaths by smoking dropped 30%, which was 10,000 fewer than deaths each year. Lung cancer rates dropped 30% in men 20 to 44. Cardiovascular disease also dropped 20%. Infant mortality dropped, and cases of low birth weight had gone from 8% to 6%, with a third of these cases reduced because of decreased smoking among pregnant women. Life expectancy increased 4 years for men and 3 years for women. Poland's Health Promotion Foundation caught the Polish government at the right place at the right time. They were able to capitalize on the new rulings for non-governmental organizations right when Poland Health had hit rock bottom. They focus on education, awareness, and reaching out a hand to help those battling their addiction. The Great Polish Smokeout was a great fun way to get the community involved and really focus on educating them in an enjoyable way and also providing a vacation getaway. What I've learned from this case study and this class in general is that education can do amazing things. Just by advertising the risks and letting people know what could happen to them and their immediate effects if they stopped, helped Poland not only stop their tobacco-related diseases and cancers, but the overall health of Poland. Poland is continuing to do what they've been doing and using tax money to further educate the people, as well as assisting those who are trying to quit. Many countries today are following Poland's lead. Even America has a great American smokeout. By the end of 2006, more than 130 countries have begun implementing a program just like Poland. Although they are not as developed as Poland's program, they are working on getting the cooperation of their government to tackle smoking and its consequences.